Hi guys, good morning. Welcome to Rise and EduTech platform. We are learning reproductive health. In that chapter, today's topic we are going to discuss is infertility and assisted reproductive technologies, that is ART. So first, let us discuss about infertility. What do you mean by infertility? Means if the couple are not using any contraceptive methods, and even then they are involving in active sexual life, and even then they are not getting pregnant, means that is called as infertility. And that too for continuously for 2 years they are not using any contraceptive methods, and even then they are not getting conceived, means that condition is called as infertility. And again, this we can divide it into primary and secondary infertility. So primary means not even once conceived. This condition is called as primary infertility. And in secondary infertility, they might have been conceived for first time and miscarried, or else first baby they got, and if they are trying for second baby, it was not working out, means that was also called as infertility. Okay, so here secondary means that is at least once got pregnant, but due to some defects, again it is that is miscarriage of the baby, or else for the second time they are not able to get pregnant, means that is called as secondary infertility. So the reasons for this are so many reasons are there: physical, congenital disorders and other diseases of reproductive system, hormonal imbalance, drugs, immunological or even psychological reasons are there for infertility. So generally, earlier days, female was blamed. Female was blamed for infertility. Okay, but mostly infertility, but most of the reasons male are responsible for that. Male are mostly a reason for this infertility. Okay, so again, this can be treated, infertility can be treated in most of the cases by developed technologies which are available today in hospitals. Okay, so the technologies which are available for curing this infertility condition is called as assisted reproductive technologies, ART. Okay, so that's what infertility is, and that can be cured in most of the cases. So what are the assisted reproductive technologies available? Let us see one by one. There are so many technologies available based on the problems which are existing in the couple. Okay, so as I told, in some cases female also has some problem, or else in most of the cases male are having problems with this infertility. And what kind of problem is existing, whether in male or female, based on that any one of the following technologies can be used to rectify infertility. Let us see one by one. So in vitro fertilization, this is important and very what to say, that is very impressive technology which is used to cure infertility. So what do you mean by IVF? That is in vitro fertilization. What is the meaning of in vitro and in vivo, Nandini? In vitro means
artificial, outside the body.
Outside the body, that is in lab. And what do you call, like which is happening in body, inside body?
In vivo.
In vivo. Okay, so here what we are going to do is, in this method, we are going to collect egg from female and sperm from male, and we are going to provide all the fertilization environment in lab. Okay, and we are producing zygote. Okay, egg is drawn out from the female body, and sperms after ejaculation it is getting collected from male, and ova and sperms are fused together in laboratory conditions. So this is called as in vitro fertilization. So outside we made fertilization, that is fusion of gametes we are artificially carrying out in the lab. So after that, what will be formed? So ova got collected and sperm got collected, and fusion of both the gametes will produce zygote. Okay. So this zygote will be transferred to the female body. So see here, this is directly transferred. The zygote is directly transferred to, because only after 32 cell stage, blastocyst is getting implanted in the uterus during implantation procedure. But here, this zygote at 8 celled stage, if you take at 8 celled stage, this is inserted into fallopian tube or oviduct. That is called as zygote intrafallopian transfer. ZIFT. Okay, but at the same time, if we are allowing this zygote to grow in the lab condition itself up to 32 cell stage, which is called as blastocyst. So after this stage, it can be directly implanted into the uterus. This is called as intrauterine transfer, that is IUT. So here how the questions can be asked is, what is ZIFT? So in ZIFT, zygote which is formed outside the body is getting transferred into the fallopian tube of female body. But if we are developing the zygote again in the lab up to 32 cell stage, this can be implanted directly to the uterus. That is called as intrauterine transfer. And one more important, that is interesting thing you have to remember is, one second. Yeah, so first test tube baby. So this is otherwise called as test tube baby technology. And first test tube baby formed by IVS technology is Louis Joy Brown. Louis Joy Brown in the year 1978. In the year 1978, and this work was done by Dr. Edward and Patrick. Dr. Edward and Patrick. Okay, this is one of the important thing you have to remember again. And so this is very easy to remember. That is in vitro fertilization. We are taking out the gametes from female and male body, and we are making them to fuse together outside the body in the laboratory conditions. And we have to provide all the temperature, pH, all the environment in a test tube. Okay, or else any vials we are taking and the gametes. And after the zygote formation, we have to ensure whether the zygote fusion of gametes happened successfully or not. And after getting confirmed with zygote formation, exactly the zygote can be directly transferred at the 8 cell stage. Zygote will be divided into 2, 4, 8, 16, 32 like that. And if we are going to transfer at 8 cell stage, it can be directly inserted. It can be directly transferred to fallopian tube of the female body. And again, if you are making the zygote to develop up to 32 cell stage, which is called as blastocyst, that can be directly implanted into uterus, which is called as IUT, intrauterine transfer. Yeah, that's all about first technology. Second, again, zygote intrafallopian transfer. What is zygote intrafallopian transfer? I explained that is from zygote to morula, in between the stages are called as, that is the cells which are formed in the stages are called as blastomeres. And if you compare the zygote and blastomere, if you compare, Okay, zygote and blastomere. So in blastomere, DNA content is more. DNA content, that is entire morula, content of morula high when compared to higher than zygote. But cytoplasm remains same. So this concept you have to remember again. Okay, I think you remember what is cleavage, what is blastulation, gastrulation, morula to blastocyst. And again, gastrula, blastocyst again 32 cell stage, morula again 8 to 16 cells. Okay, and this is blastulation. And here, what is the difference between blastocyst and gastrula? Gastrula, germ layers are formed. And this process is called as gastrulation. Okay, yeah. So as I informed, the intrauterine transfer, IUT, if you take, that is more than 8. And if more than 8 cells are present, directly we can transfer the embryo into the uterus itself. So embryo formed by IVF, in vitro fertilization, is also used for such transfer to assist those female who cannot conceive. That is directly in vivo fertilization, embryo formed by in vivo fertilization, they can directly withdraw the embryo. So if I'm not able to produce egg itself from my body, I cannot donate egg. Okay, so in that condition, directly I will get egg from donor, and my husband's sperm will be used. Okay, one condition. Otherwise, that is embryo itself directly can be transferred, which is happening in other female body by in vivo fertilization. Yeah, second technology is again gamete intrafallopian transfer. Gamete intrafallopian transfer. So here it is clear. See, if any female, they are not able to produce ovum, they will get ovum from donor and directly that is inserted into the ampullary region of fallopian tube. That is called as gamete intrafallopian transfer. Okay, yeah, so this is very easy. There, IVF is possible when ovulation is there. Okay, when ovulation is happening, but other due to some other hormonal imbalances or some other problems, fertilization is not happening, means we can withdraw ovum and sperm and we can make fertilization to happen outside the body. But here fertilization is happening inside, but there is no ovulation. All other conditions in that female is perfect except ovulation. So that lady is not producing eggs. So in that condition, we can collect egg from any other female donor and we can insert directly into the fallopian tube. So here, that is, egg is directly transferred to the fallopian tube. Yeah. So third technology is intracytoplasmic sperm injection. ICSI, intracytoplasmic sperm injection. See here again, directly in laboratory condition only, we are injecting the sperm. We are selecting a sperm and single sperm we have to select and inject it directly to the cytoplasm of egg. Okay, so and again after this fertilization, embryo will be developed, and again we have to go for either zygote intrafallopian transfer or intrauterine transfer. Okay, yes. So in IVF, what we are doing is we are not injecting directly, just we are giving environment for the fusion of gametes outside the body. Here directly we are selecting a good sperm. We are selecting a good sperm from male and directly injecting the sperm. We are making fertilization to happen. Okay, by injecting the sperm directly to the egg cytoplasm. This is called as intracytoplasmic sperm injection, ICSI. And fourth one, so this is for which are having that is in which the male are having infertility, male are infertile in nature. See, some male, if they are not able to inseminate, not able to ejaculate forcefully, what will happen means the sperm is not able to reach the egg which is waiting in the fallopian tube. So in that condition, this AI technique is very much useful. Okay, so again, there here the semen will be collected from the male and again injected into the uterus of female. So here again, from here, this sperm will move and reach the ampullary region where the egg is waiting. Okay, so again, artificial insemination into uterus is known as intrauterine insemination. IUT is intrauterine transfer of blastocyst. IUI is intrauterine insemination. We are injecting the collected sperm directly into the uterus. Okay, so this is used when only when the male partner is having inability to ejaculate during coitus. And again, one more thing is due to oligospermia. What do you mean by oligospermia? Nandini?
No sperm count.
Yeah. Or aspermia?
Absence of sperm.
Yeah. Yeah. Yes. So fifth one is surrogacy. So here, surrogacy means most of the celebrities, they are going for this method nowadays to maintain the physical figure. And again, here, if a woman that is surrogate mother bears a child for that is everything here, the male will donate sperm and female will donate egg. Fusion will happen. Okay, zygote will be formed, but directly the zygote is not inserted to the female donor. Okay, but this will be inserted to the surrogate. Okay, so for 9 months during gestation period, this surrogate mother is responsible for taking care of the fetus. Okay, so this is again, for example, some of the female, those who are not able to carry, that is their uterus is not in a condition to carry the fetus means they will go for this surrogacy, and surrogate is impregnated through artificial insemination also. If some female are not possible to ovulate or both the problems are there means ovulation and implantation, gestation, all the problems are there in a female means directly they will collect sperm and inseminate. Inseminate to surrogate body. Okay. So at this condition, that is the fertilization will be in vivo. Or else, if we are taking, that is in vitro and in vivo, both are possible here in surrogacy method. Okay. If directly we are inserting sperm, this is called as in vivo fertilization. Here, this is called as in vitro. That is the difference. Okay. Yeah. So what are the problems in these existing in these assisted reproductive technologies means this require high precision handling by specialized professionals. Anybody can go and take out the sperm, take out the ovum, and we can mix it. It is not like that, like making a coffee. Okay, so it should be handled only by specialized professionals, and so many what to say, that is infrastructure is needed. And again, in society, emotional, religious, and social problems are also there. So in a family, everybody should accept for surrogacy or anything. Okay, that is any of the above mentioned procedures. If they have to follow me, they have to get what to say, opinion from their family members also. The couple alone cannot decide anything. That is in our society. And again, legal adoption is one of the best methods. So if the couple is not ready to undergo, because each and every step, it is not sure that in the first trial itself, IVF will be successful. So per IVF, we have to spend in lakhs. So it may be successful or unsuccessful also, and it may be successful on fifth time also. So that much money also we have to spend. So the only easy way is to adopt a child. Okay, it is legalized in India, and easily by following the legal procedures, one couple can adopt the child. Yeah, that's all. So all these 5 methods are clear, I think, Nandini.
Yes, ma'am.
Yeah, shall we discuss questions?
Yes, ma'am.
From this chapter? Yeah. First question, which of the following groups includes all STDs? STDs, okay? Listen, first option, hepatitis B, hemophilia, AIDS. Here, hepatitis B and AIDS are STD. What about hemophilia?
Genital disorder.
Very good. Second option, AIDS, syphilis, cholera.
Cholera is a
Is not.
bacterial disease.
Yeah, very good. And again, gonorrhea, hepatitis B, chlamydiasis.
Option C, ma'am.
Yeah, very good. So, what are the STDs you know? Tell me. Gonorrhea, hepatitis B, genital.
Genital herpes, genital warts. Chlamydia.
Meiosis.
Syphilis.
That's all, na?
Trichomoniasis.
Yeah, trichomoniasis. Okay. Okay. So, which of the second question? Which of the following is widely accepted method of contraception in India?
Sterilization.
No.
IUD.
Yeah, IUD. India, IUD is mostly accepted. Yeah, and again, third causative agent of syphilis is
Trypanosoma pallidum.
very good. Trypanosoma pallidum. What is the function of copper T?
Decrease the motility of the sperm.
Yeah, and thereby prevent fertilization. Okay, here the option given is prevent fertilization. Stops cleavage, checks mutation, stops gastrulation, stops fertilization. Which option is correct?
Prevent fertilization.
Yeah, okay. And again, amniocentesis is a process of what is the role of amniocentesis? What do you mean by amniocentesis?
To check whether the baby has any genital disorders.
Yeah, yes. That is in embryo. In embryo, if any diseases is there, we can find out by the procedure, and for which it should not be used.
Sex determination.
Yes, sex determination. It is not legalized. Okay. And again, Saheli is
Oral contraceptive
very
for
good.
female.
Yeah, yes. And again, which artificial reproductive technique can help a lady conceive a child if both her fallopian tubes are blocked?
Intrauterine transfer.
Totally IVF, in vitro fertilization. Okay. In vitro fertilization.
Okay, ma'am.
Which of the following is not a copper releasing IUD? LNG20, copper T, Lippies loop, 1 and 3.
1 and 3.
Which of the following is not a copper releasing? Yeah, yes. I think you remember what are all the contraceptive, that is IUDs available. IUDs, what are the IUDs available? Tell me.
Non-mediated. Copper T.
Example, non-mediated.
Non-mediated Lippies loop. Copper releasing. Copper T.
Example, copper T, multi-load 375.
Then hormone releasing LNG20 progesterone.
CU7 is also there, right?
Yes, ma'am.
Yeah, and hormone releasing LNG20 and progesterone. Okay. Which of the following is characteristic of an ideal contraceptive? Easily available, user-friendly, effective with least side effects, irreversible. Tell me which of the following is the characteristic of an ideal contraceptive?
Options, ma'am.
See, that is generally the contraceptive should be easily available, user-friendly, and effective with least side effects. It should not be irreversible. So if we are using copper T, if we remove copper T, again pregnancy is possible. That is called as reversible contraceptive methods. Yes or no? And again, if pills, a lady is taking a pill that is continuously Saheli for 1 year, and if she is stopping Saheli or Maladi, automatically she can get conceived. So this is called as reversible. It should not be irreversible. So mostly irreversible surgical methods, sterilization procedures, vasectomy and tubectomy are irreversible mostly. Okay. What is the expansion of MTP?
Medical termination of pregnancy.
Medical termination of pregnancy. So here in this chapter, so many abbreviations you have to remember. Medical termination of pregnancy. See, IUI, IUT, just by giving exactly similar words to confuse you, they'll give in options. Okay, so read it carefully, and all the abbreviations you have to be thorough with. What is RCH? Tell me. What is RCH?
Child
Healthcare.
Health Program.
Health program, healthcare program. And again, what is ART?
Assisted reproductive techniques.
What is AI?
Artificial insemination.
What is IUI? Intrauterine insemination. Intrauterine insemination. What is IUT? Intrauterine transfer. What is that is GIFT? ZIFT? Zygote intrafallopian transfer. What is GIFT?
Gamete intrafallopian transfer.
Very good. And again, anything missed out? Yeah, ICSI.
Intracytoplasmic sperm injection.
Yeah, very good. Mostly everything we have IVF.
In vitro fertilization.
HIV. Human immunodeficiency virus. Okay, human immunodeficiency virus. AIDS. AIDS, acquired immunodeficiency syndrome. Got it, dear?
Yes, ma'am.
Human immunodeficiency virus that is causing acquired immunodeficiency syndrome. Okay. And IUD?
Intrauterine devices.
Yeah, very good. So these are the terms you have to remember in this chapter. Okay. Yeah. Next question. Which part of the female reproductive system remains blocked after tubectomy? After tubectomy, yeah, fallopian tube, very good. A widely accepted method of contraception in whole world is widely accepted method.
Barrier method.
Yeah, which barrier method? There are so many barrier methods like diaphragms, walls, cervical caps. Worldwide accepted barrier method is condoms. Okay, what is the in India? Which condoms? Everybody know? Example. Male. So this is for male. Okay. By which name is family planning currently known as? In India.
Here, ma'am.
No. Which name? By which name is family planning currently running? RCH. Reproductive and child health care. Got it?
Yes, ma'am.
Yeah. So which problems in reproductive health care require doctor's help? STDs, conception, parturition and abortion, contraception, that is different options are given. First option, STDs. I informed, that is at initial stage itself, if we are having any early symptoms, we should not hesitate to go and meet the doctors. Okay. So for STD, we have to visit doctors. Conception, that is for pregnancy. Parturition for delivery, and for abortion, we should not take any medications without the advice of doctor. For these three also we need the consultation with doctor. And again, contraception, infertility, menstruation. And even for the first time, if a female is willing to take some contraception, or else if they are willing for IUDs, definitely they have to meet and get suggestion with the doctor. So all these STDs, conception, parturition, abortion, contraception, infertility, menstruation problem, for all doctor's help is needed. Got it? IVF technique, next question. In IVF technique, zygote or early embryo is transferred into?
Fallopian tube.
Yeah. The programs to get total reproductive health as a social goal of national level are called family planning. Okay, the programs to get total reproductive health as a social goal of national level are called as family planning. And which year it was introduced in India?
1951.
Yeah, 1951. Test tube baby implies which of the following techniques? Test tube baby.
IVF.
Yeah. Yes, IVF. Okay. And again, one more thing. See here, that a test tube baby implies which of the following techniques means, again, IUI is there, ICSI is there, IVF is there, ZIFT is there. ZIFT. Which one is most important? Not understanding?
Yes, ma'am.
See, test tube baby implies which of the following techniques? They have given IUI, ICSI, IVF and ZIFT. Important is ZIFT. So even though if you are forming zygote by in vitro fertilization, we have to insert it into fallopian tube. Yes or no?
Yes, ma'am.
Yeah. So this is very important. See here in this question, they have given both IVF and ZIFT. You have to go with ZIFT. Okay.
Yes, ma'am.
What is next question? What is the reason for popularity of barrier method of family planning? The absence of side effect, first option. Privacy of the user is confined, no side effects.
No side effects.
Both no side effect and privacy of the user. So what are the barrier methods? Tell me. What are the barrier methods?
Cervical caps,
Uh,
walls,
creams and jellies, foams, okay, walls and caps. So for this, no need of doctors or no need of medical practitioners. Yes or no?
yes, ma'am.
So they will be having privacy. Got it?
Yes,
So
ma'am.
the absence of side effect and privacy of the user is confined. Both 1 and 2 is the right answer. Next question, which is the physical barrier method for family planning in female? Condom for male, condom for female, diaphragm, both 2 and 3.
Options, ma'am.
Condom for male, first option. Second, condom for female. Third, diaphragm. Fourth,
2 and 3, ma'am.
2 and 3. Very good. Which of the following is not a natural family planning method? Natural, okay? Periodic abstinence, coitus interruption, chemical method, lactational amenorrhea.
Chemical method.
Chemical method. Which is not related with a reference to hormonal contraceptive pills. Which is not related with reference to hormonal contraceptive pills. Option 1, prevent ovum to release from the ovary. Contraceptive pills will prevent ovulation. This is correct. Thickening of cervical mucus. This is also correct. Inhibits sperm penetration. Contraceptive pills inhibits sperm penetration. It is not done by contraceptive pills. Okay. Contraceptive pills, they can change the hormonal levels. So this is the option you have to select. And fourth option, inhibition of motility and secretory activity of oviduct. This is also happening by hormones which are present in the contraceptive pills. Understood, or I have to repeat this question, Nandini?
No, ma'am, understood, ma'am.
Yeah, okay. Which are the permanent methods of family planning? Permanent methods. Permanent, irreversible.
Sterilization.
Yeah, sterilization. That is both vasectomy and tubectomy. In vasectomy, which part is tied and cut?
Vasa differentia.
Yes, vasectomy, vas differentia. So vas difference, and in this you have to remember semen will be produced without
Sperms.
yeah. Yes, again, what is the correct surgical method for preventing pregnancy in which vas difference is correct? Is cut, vasectomy. Okay, what is hysterectomy?
Removal of uterus.
Yeah, very good. In dash, the egg is first fertilized outside the body and then it is inserted into the oviduct. GIFT, ZIFT, IUI, ICSI. In dash, the egg is first fertilized outside the body and then it is inserted into the GIFT. Yes, the highly sophisticated procedure of directly injecting sperm into egg is called ICSI. Very good. Emergency contraceptives may prevent pregnancy if used within
72 hours
of coitus. That is important. Okay, 72 hours after fertilization they will give. Okay, 72 hours of after coitus. Okay, 72 hours of coitus you have to select. Oral contraceptive pills in birth control by oral contraceptive pills help in birth control by killing sperm.
Prevent ovulation.
Prevent ovulation. Very good. MTP is considered safe up to
first semester, 12 weeks.
First trimester or 12 weeks. Gamete intrafallopian transfer mixes egg and sperm in the gamete intrafallopian transfer.
In vitro.
In fallopian tube only. Gamete intrafallopian tube mixes egg and sperm in which part? Fallopian tube, uterus, vagina, culture medium. Yeah. The permissible use of the technique amniocentesis is for detecting any genetic abnormalities. Yes. Which one of the following statement is incorrect regarding IUDs? IUDs, intrauterine devices. Incorrect. Okay. These are small pieces of plastic or metal that are inserted into the uterus. First option. Second, they should be removed only by healthcare provider. This is also correct. First one is also correct. IUDs prevent pregnancy by creating a mild chronic inflammation. IUDs offer protection from sexually transmitted diseases. Which one is wrong?
D, ma'am.
Yeah, D. Because which one will give protection against STDs? Condoms. Got it?
Yes, ma'am.
Yeah, the technique called gamete intrafallopian transfer, GIFT, is recommended for those females. GIFT is needed for those females who cannot produce ovum. Got it?
Yes, ma'am.
Yeah, in vitro fertilization is a technique that involves transfer of which one of the following into the fallopian tube? Into the fallopian tube.
Gamete.
Gamete. In vitro fertilization.
Zygote, ma'am.
In vitro fertilization is a technique that involves transfer of which one of the following into the fallopian tube?
Zygote.
Either zygote or early embryo. Up to 8 cell stage. Okay. So up to 8 cell stage we can insert into fallopian tube. After that we have to insert into uterus. Got it?
Yes.
Yeah, copper ions released from copper releasing intrauterine devices prevent ovulation, make uterus unsuitable for implantation, increase phagocytosis of sperm, suppress sperm motility.
Suppress sperm motility.
Sperm motility. Yeah, very good. Which of the following statement is wrong regarding MTP? In India, it is legal up to 20th week of pregnancy. MTP, which one is wrong? You have to select. Yes, based on 2017 amendment, up to 20th week, we can carry out abortions. Okay. MTPs cannot be done without surgery. Is that correct?
No.
Yeah, by pills itself they can make abortions. Okay, this is wrong actually. And what is the work of progesterone which is present in oral contraceptive pills? What is the role of progesterone?
Prevent ovulation.
Yeah, very good. Progesterone prevent ovulation. Generally, it is produced only after ovulation by corpus luteum to maintain pregnancy. Got it? What is the work? Yeah, ZIFT is ZIFT transfer of zygote into fallopian tube. Okay. Yeah. So this please listen carefully. This is a big question actually. Select the option which correctly fill up the following statements. Destruction of embryo or fetus in the uterus is called feticide. Killing fetus. Killing fetus in uterus is called feticide. Okay. And Government of India legalized MTP in the year 1971. Got it, dear? Sorry, MTP legalized in the year 1971. This is also important. And third is natural family planning method is also called natural family planning method. What are the natural family planning methods? Coitus interruptus, lactational amenorrhea, and periodic abstinence. So these are also called as rhythm method. Okay, natural methods are also called as rhythm method. Dash is a method in which the male partner withdraws his penis from vagina just before ejaculation. Coitus interruptus. Got it?
Yes, ma'am.
Yeah, last one is again 5 fill-ups they have given in single question. Dash is the copper releasing and is a hormone releasing intrauterine device. See, there are so many options given. Multi-load 375 is one of the copper releasing IUD and hormone releasing LNG, LNG 20 or progesterone, anything can be given in that. Yeah, but one more question. IUDs increase phagocytosis. IUDs increase phagocytosis of sperms, release copper ions that suppress sperm motility and fertility capacity of sperms, make the uterus unsuitable for implantation, make the cervix hostile to sperm, prevent semen from entering the female reproductive tract. IUDs.
Increase phagocytosis of the sperm.
All of the above which I mentioned. IUDs, copper releasing IUDs, they will, second option is for that. Hormone releasing IUDs make unsuitable for implantation. All are correct. Okay.
Okay.
Yeah, which of the following STDs cannot be cured? Syphilis, gonorrhea, chlamydia,
Genital herpes.
genital herpes. All of the STDs are curable if detected early and treated properly, except
Hepatitis B, HIV, genital herpes.
yeah, very good. The test tube baby program employs which one of the following? Test tube baby. Zygote intrafallopian transfer. Test tube baby, IVF and ZIFT. Both you have to remember well. Okay.
Yes, ma'am.
Contraceptive pills are very effective with lesser side effects and are well accepted by the female. Is it true or false? Contraceptive
Yes,
pills
ma'am.
are, yeah, okay. Which of the following causative agents of STDs can cross the placenta from mother to baby? So what are the STDs which are transmitted from mother to child?
Hepatitis B, HIV.
Very good. Yeah, hepatitis B virus can cross, HIV can cross, and one more is syphilis. Okay. So these three causative organisms can cross placenta. Which one of the following is the world's first non-hormonal, non-steroidal contraceptive pill?
Saheli.
Very good. World's first pill is Sahel. Non-steroidal, that is very much important. Non-steroidal. Yeah, so what is the mechanism of this Saheli? Estrogen receptor modulator. It is functioning as estrogen receptor modulator. Okay. A female who is on contraceptive pills stops taking them, which of the following will be the immediate effect? So if the female is taking pills and she stops taking pill, means immediately menstruation will happen, menstrual bleeding occurs. Which of the following STIs can be transmitted by sharing needles? Genital warts, hepatitis B, genital herpes, and trichomoniasis.
Hepatitis B.
Yeah, yes. Lactational amenorrhea is a natural method of contraception. It is due to high level of, this is very much important. During lactational amenorrhea, prolactin level will be high. Prolactin level will be high. So this will prevent ovulation. That is follicular phase will be inhibited. Okay. Select the odd one with reference to IUDs. Lippes loop, multi-load 375, Progesta cert, implant. Implants, yeah, implants where they are inserting in arms under the skin. Okay. Yeah, which of the following contraceptive methods prevent ovulation? Copper T? No. Okay. LNG 20?
Yes, ma'am.
This one, yes. Contraceptive pills prevent ovulation. Diaphragm, it is barrier. Okay. One more is Norplant. Norplant. Norplant, whether it is hormone or not.
Hormone.
Injectables, yeah. Implanon and Norplant are examples for implants. Okay, implants and injectables. So these are filled with hormones only and they will interfere with ovulation. So among the given 5 options, that is copper T, LNG 20, contraceptive pills, diaphragm and Norplant, only copper T and diaphragm are not involving in
Prevention of
ovulation process. Yes. The contraceptive methods which have an additional advantage of preventing spread of STDs are condoms. This we discussed already. Okay. Tablets prevent female contraception contains, yeah, progesterone or else progesterone estrogen combination. Okay. Yeah. So I think it's enough